Thanks for joining us today. We'll be talking about managing triggers, appointments, milestones, and unexpected reminders.
Triggers. Even the word may carry weight for you, and it does for us. It's important to notice and be able to identify what causes us to react because that's all a trigger really means. It's not a judgment about who you are or your strength. It's just simply something that gets us activated. Um, Unfortunately, you have to have been triggered to realize what your triggers are. And navigating fetal care and postpartum are not easy. Triggers can be a person, a place, a sound, a smell, even a thought that brings up a really strong emotional reaction. And during fetal care, certain situations may feel unexpectedly painful.
Common triggers are social media posts about pregnancy, birth announcements, baby showers, hospital waiting rooms or exam rooms, questions like, how's the baby? Other parents' comments or jokes about pregnancy or maybe an easy or unexpected pregnancy that they are experiencing. Unsolicited advice, especially around carrying or terminating a pregnancy. Important announcements, ultrasound scans, milestone dates like birthdays and due dates, sights, sounds, events, or smells that remind you of baby and specific moments in your experience thus far.
Here are ways to address specific triggers. First, get curious about what triggers you. Triggers are your mind and body's way of trying to keep you safe. They help us detect danger and to help reduce the impact of a trigger and give you more control over how you respond. uh, we first have to have compassion for ourselves and curiosity about what we're experiencing. Think of this skill like stepping into the role of a research scientist and getting out your mental clipboard and start taking notes.
Write down your triggers. Awareness softens their impact and it will help you recognize them early.
Deciding ahead of time what events you'll attend, skip, or leave early. As we shared in the relationships with others video, setting these boundaries doesn't require an explanation on your part, and you should be specific and clear.
Take a break from social media. We know there's a lot of good on social media, even in supporting pregnancy. But in a time like this, it's important to know you may hit a trigger by scrolling. Mute specific accounts or topics if you are going to stay on social media. Consider stepping away, even temporarily. Try intermittent fasting, even of social media.
Make pre decisions regarding medical appointments. Before appointments, make small pre decisions. Who will be coming with you? What questions will you be asking? Where will you wait for that appointment? And studies show anticipatory anxiety or grief before medical appointments is very common, and it can really heighten your stress responses. Um, so, as you proactively manage your medical care, you may reduce the triggers related to that.
While we won't discuss return to work or big life chapter transitions in this video, do know that these are contexts where new triggers will also come up. Carry Me Health and your broader cast of support will be there to help you through these transitions. New triggers can occur with your coworkers or work environment, in the NICU, in grief share contexts, or with big dates like milestones and holidays. In closing, your emotional safety matters and triggers can be well managed when they are known and you have intentional ways to address them.
Triggers are a normal part of medical stress. They can show up in the places that you might expect, like hospitals or doctor's offices, or even in the places that you might not, like the grocery store. You are not being overly sensitive. You are responding to a high stakes emotional situation with a completely human reaction. Protective boundaries are proven to help. One of the most powerful tools that you can start using today is anticipating those moments, not judging them or criticizing them, and deciding ahead of time what type of support you might need to make your way through them.